What made a female patient refuse all the male doctors in the building? The first thing I noticed when I entered the patient's room was her deep sunken eyes and pale, cracked lips. I approached her cautiously, remembering how the charge nurse warned, the girl refused all male staff. We all knew what that meant, and she looked as broken as I imagined. I pulled up a chair next to her bed instead of standing over her, and gently asked if she wanted some water first. She nodded. Sweetie, you're safe here, I said, keeping my voice soft like I do with my anxious patients. The male staff won't come near you, I promise. It's just us girls here. She looked at me for the first time and whispered, he's here. I asked who, and at first she refused to even say his name. I handed her my pen and clipboard. After a second, her hand moved. Percy. My blood boiled at the name. He was my everything, she finally whispered, and started showing me photos on her phone of them together at college, confirming that it was the same Percy who is now a resident at the hospital. I did everything for him. Everything. Her voice cracked as she swiped to screenshots of assignments, timestamps showing her submitting his biochemistry homework at 3 a.m., his pathology essays at 4 a.m., his anatomy exams that she'd taken for him. She showed me his Instagram from those same nights, him doing beer pongs and body shots with other girls while she was writing his thesis on cellular biology. The day after graduation, after I'd spent 3 years making sure he got into residency, he sent me this, she said, and handed me her phone. The text made me want to throw something. Babe, you're too clingy and it's honestly suffocating. I need to focus on my career without distractions. And honestly, doctors are supposed to date doctors, and you're not one. We're done. Please don't contact me again. I waited until she was stable and sleeping before I stormed into the break room where 3 other nurses were charting. You guys are never going to believe what I just found out about Percy, I said. I told them everything and watched their faces go from confused to furious. And within 10 minutes, we had half the female staff crammed into that tiny break room. I knew something was off when he asked me to explain what antibiotics were, said June from pediatrics. And Dr. Sydney, our attending, walked in right as someone said, we should report him, and she closed the door behind her. Actually, I've been documenting his knowledge gaps for weeks, she said, pulling out her phone to show us pages of notes. But this explains everything. The room went quiet while we all looked at each other, and then Lita from the ICU said what we were all thinking. Ladies, we don't need to destroy him. We just need to let him destroy himself while we enjoy every second of it. The plan rolled out so naturally it was almost beautiful to watch. Percy started getting paged for every code brown at 3 a.m., always somehow being the only resident available for the worst cleanups. Female nurses became suddenly too busy to help him with procedures that a first-year student should know, forcing him to admit to attendings that he didn't know how to do basic tasks. Dr. Sydney started calling on him during every morning rounds, asking him to explain fundamental concepts in front of the department heads, and watching him fumble through nonsense answers. After 3 weeks, Percy was too scared to look at any of the female staff in the eyes. He kept his eyes lows, hid in the bathroom during lunch breaks. But we weren't done with him just yet. We documented everything meticulously in the system, using phrases like concerning gaps in foundational knowledge and required extensive assistance with basic procedures in every single report. Then somehow the story made its way to our female residency director, Dr. Yao, who decided Percy needed a comprehensive review of his medical knowledge. The universe must have a sense of humor because his ex was in Dr. Bert Yao's office for her follow-up appointment when Percy got called in for his emergency evaluation. Dr. Yao didn't even tell him to wait outside, just started right in with, Dr. Percy, please explain the mechanism of action for beta blockers. He stammered through some nonsense, and his ex, still sitting in the patient chair, quietly said, that's not right. Dr. Yao raised an eyebrow and said, would you mind sharing what you know? And his ex rattled off the perfect textbook answer she'd written for him 2 years ago. This happened 3 more times. Dr. Yao would ask simple questions like antibiotic resistance, and Percy would stand there completely silent, staring like a headless chicken while his ex proceeded to answer everything flawlessly, each time growing more confident. Dr. Yao stared at him over her glasses and said, this is first-year material, Dr. Percy. Material that my patient seems to have mastered without even attending medical school. As expected, Percy failed his performance review and had to repeat his entire rotation, adding a full year to his residency. 6 months later, his ex-girlfriend showed up for a medical school tour as their star applicant with the highest pre-med GPA we've ever seen, and a scholarship from Dr. Yao. I watched Percy's face drain of color when she walked past him in her interview suit, looking healthy and confident. The female staff at every hospital in the network knew his story through our group chats, ensuring his reputation as the fake doctor followed him everywhere. Last I heard, he was on his 3rd rotation repeat while she'd gotten early acceptance to Johns Hopkins, and that's how an entire hospital of women made sure Karma got her medical degree.